My name's Stuart Bergler. I'm a paramedic, firefighter. I'm the inventor of the Emergency Dermal Kit. It's a series of medical devices that improve burn care in emergency medicine. When it comes to severe burn patients, do we honestly think the current standards of care sufficiently address what both the patients and providers need? Do we honestly think that gauze, loose and bulky dressing, or burn sheets directly address these symptoms? We're not saying the current standard of care is bad for a small burn. However, in the event that we have a critical airway, breathing, circulatory concern, we can abandon wound care obligations altogether. It's too long and tedious. We invented a low-tech, straightforward solution for this problem. It can be applied in a fraction of the amount of time and all but guarantees a higher degree of insulation for hypothermia, sterility for infection, loose and bulky application for the hypoperfusion and physical and emotional pain these patients experience. The Emergency Dermal Kit is boldly labeled on the front. It's a durable yet flexible material built to protect the integrity of the package devices inside. This is getting more important as patient care compartments in the back of ambulances are built with safety in mind, and we're losing cabinet space. The back of the kit has an adult rule of nines and a severity guide on it. I don't have data on this, but if you talk to anyone that has been in the burn unit long enough, they all have stories of emergency medical staff overstating or understating the severity of these injuries. Our guides are simply printed on the back for quick reference. We're packaging our devices in durable plastic, not Tyvek. This provides a puncture-resistant seal for devices that protect infection-prone flesh. Before we introduce each individual device, we wanted to demonstrate our patent-pending textile layering. The first layer is a high-quality non-adherent. It's likely more robust than any non-adherent pad you've used before. It's gentle on sensitive flesh. Our middle layer is absorbent and it's insulating. It does a good job of moving oozing fluid away from the wound bed. Our third layer is a protective, high-strength polypropylene layer. It's still flexible and it protects and encapsulates the sterile wound contact and the insulating absorbent layers. The interior and exterior layers are intentionally different colors. We'll get into that later. Anyone that has ever had to wrap multiple digits knows how tedious and impractical this can be. A lot of agencies are using gauze or loose and bulky dressing to treat these injury types. This is our hand glove. The sterile, non-adherent, and absorbent layers are encapsulated by the exterior polypropylene. Our hand gloves have spacious finger partitions to keep digits separated, and it secures like a large mitten. It goes on in seconds, creating an immediate visual partition for your patient, bystanders, and responders not to get fixated on. In order to emphasize how we want the wound contact layer to only contact affected flesh, we want providers to remember white goes to wound, blue goes to you. Unofficial internal studies at the local college showed on average it takes EMS personnel 2 minutes and 21 seconds to wrap an entire hand with 2-inch gauze. Ours applies in 21 seconds on average. If you're not initially using gauze, then you're probably using non-adherent pads. Why piecemeal a series of small, friable squares or rectangles in a non-sterile, slow fashion that still ultimately require gauze wrap when you can isolate and protect an injury in seconds with a cohesive, non-adherent layer device? With regards to the arm sleeve, it encases the entirety of an injured arm from shoulder to wrist. We wanted radial pulse access left open between the sleeve and glove for monitoring purposes. We built the arm sleeve with IV, IM, and vital sign access, but suggest you collect vital signs and provide interventions elsewhere if you can. Preliminary studies at the local college suggest on average it takes 1 minute and 21 seconds to wrap an entire arm with 3 or 4-inch gauze. Ours applies in 16 seconds on average. Water-soaked dressings are appropriate for small burns, providing cooling, pain relief in a square package. However, with prolonged use, in a large burn area, these water-soaked dressings pose a real risk of hypothermia to these patients. We recognize the need for an insulating, loose and bulky, non-adherent, sterile device is becoming more important in our industry. Our obligation to isolate and protect these wounds and get them to definitive care with as minimal topical interaction as we can possibly provide. Unofficial internal studies at the local college showed on average it takes EMS personnel 2 minutes and 8 seconds to wrap an entire leg with 4-inch gauze. Ours applies in 23 seconds on average. When it comes to abdomen, thorax, posterior, neck burns, we find ourselves pretty limited with wound care devices. Probably the most popular is a sterile burn sheet, applied to the cot and one placed atop the patient's body. Instead, we wanted to include 3 devices for this neglected anatomy. We have a sterile cot sheet that fits over any EMS stretcher in every kit. After that, we have a torso blanket, which is nothing but a glorified Chuck's pad. It's simply sterilized and thicker for insulation purposes. White goes to wound and blue goes to you. With regards to neck burns, we built a neck gaiter with the same textile assembly. While our neck gaiters are sterile, insulating, loose and bulky dressings, you can secure together or take off easily enough. The unique shape of craniums and feet led us to employ standard wraps to treat burns. Preform anatomical wraps were not practical for this anatomy. We have 1.5 inch and 3 inch wide wraps that are 6 feet in length for this more difficult anatomy. All I'll say is if you have to wrap it, have a strip of 1 inch tape around to secure it in place. Burn patients suffer complex wounds that require protracted stays in burn units. Our current standards of care don't cut it. The Emergency Dermal Kit's devices allow a provider to treat disfigured wounds quickly without compromising patient comfort in the process, setting up the patient for success in healing. No fumbling around in a protocol book, just intuitive devices that are panicking provider-proof.